You will never forget the difference between unfractionated heparin and low molecular weight heparin again. Come with me and I'll explain it to you in a very playful and simple way. Unfractionated heparin means that the saccharides that make up this heparin molecule vary from 10,000 to 30,000 Daltons. Similar to this here, see how there are several granules of different sizes here? Look, various sizes here, various sizes. So this doesn't give predictability to heparin, and it acts on coagulation factors 2A and 10A2A is thrombin, right? And when we talk about unfractionated heparin, the Daltons range from 4 to 6,000. In other words, it's uniform, the size is practically the same, similar to sugar granules. Look, they're all uniform, they all have the same size, so here we have more predictability. What this also means is that it won't act on 2A either. In other words, it won't inhibit thrombin, only factor 10A. But that's already enough to break the coagulation cascade and therefore work as an important anticoagulant. Now, why do we choose low molecular weight heparin in the deep vein thrombosis protocol and not this one, which is unfractionated? The reason is very simple. This one has a 1-to-1 ratio, while this one has a very different ratio compared to that one. What does that mean? That here I have predictability, my patient might have bleeding. Here I have to keep monitoring, I have to run tests to see if the patients aren't maybe at risk of bleeding or something like that. The activated partial thromboplastin factor, which is APTT, it doesn't need to. When I'm using this, it's not that it doesn't need to, but since it's predictable, it's easier here, easier for us to know that this patient will have few reactions related to this here. So in daily life, that's how it is. And because these molecules are of different sizes, this one here, because it has large molecules, it's presented in international units, and it's very common for it to be administered intravenously. And this one here, since it's smaller, it's measured in milligrams, meaning its dosage is counted in milligrams, and it's usually administered subcutaneously. It's smaller, so it can easily pass through and reach where it needs to go. This information is extremely important for anyone who is going to work in a hospital, because a patient who is confined to a bed needs to receive this therapy to prevent the formation of blood clots. If you're a professional and want to learn this, I have a complete course on medication administration.